Parkinson's disease 101. We're very lucky to have Dr. Mata, who is an expert in this and will be able to explain a lot of stuff that I don't even know yet. And then we also have Tyler, a genetic counselor. So they're both going to do this talk, and I hope you all learn a lot.
All right, good afternoon, everybody. Thanks for sticking around, missing maybe your lunchtime. So my goal of today is try to explain this, something that looks very complex, the genetics, especially the genetics of Parkinson's disease, in a simple way. So when you leave this room, you will have a clear idea of what the role is for genetics in Parkinson's disease. And I also want to highlight the importance of participating in research. So hopefully I'll give you some hints of why I think it's important to participate in research. But before I start, I wanted to to explain what genetics is. I think, again, it seems very complicated. It's really not. Is the information that we have inside of our cells that makes us really look similar to our family members, but very different to everybody else in the world, right? So we're all 99% genetically identical, but that very small percentage of differences make us all in this room look very different, unless, again, you're with a family member. So it really explains what we look, but also the risks that we might have in our lives to not only Parkinson's, but other disorders like cardiovascular disease or cancer or other diseases. So what do we know about Parkinson's disease genetics? So for many years, we've been studying families. That means that when you have another family member that is also affected from the disease, the chances of that disease being genetic is very high. So we've been studying families for a long time. We know that there's at least 24 different genes that can cause familial forms of Parkinson's disease. This means that if you carry a variant in one of these genes, you're very likely to develop the disease, and that means that your descendants also have a higher risk than the normal population to develop the disease. But in addition to that, and as you can see in the little pie chart that I put in there, familial forms of Parkinson's disease is very small piece of the pie. Most of the Parkinson's patients, more than 80% of Parkinson's patients, do not have another family member affected with the disease. That means that they're not going to be carrying one of these genes. So these genes are relatively rare amongst the whole population, but they're very important because they really help us understand what the disease is and where it's coming from, right? These genes tells us a lot about what is going on the brain of Parkinson's patients. But for the most part, in the other 80%, so in those individuals who do not have another family member affected, genetics still play an important role. And it plays an important role through these genetic risk variants. What are these? These are variants that actually do not cause the disease, but increase your risk by a little bit to develop the disease. And we know that there's at least 100 genes, 100 different genes in our cells that can predispose somebody to have an increased risk for Parkinson's disease. And I'm going to explain how everything works in the next slide and hopefully make it more clear. And the way we find these risk variants is studying very large number of individuals with Parkinson's disease, two people that are in the same age but do not have Parkinson's disease. We compare the genetic variants of those two groups, and we identify things that are more common in the Parkinson's patients than in the healthy individuals, which might be telling us that these variants might increase your risk to develop the disease. So how does this work in the real world? So as I mentioned, there's really two different subtypes of Parkinson's disease. One is the familial. Also, I included the early onset form, so individuals that get the disease before the age of 40, which is not the norm. Those cases usually have a large genetic effect versus the sporadic cases. So yes, as you can see here in the figure, if we look at a sporadic patient, right, so an individual that don't have a family history of the disease, which is most, so we all start with this genetic risk. So that means that some individuals will be born with 3, 4 of these orange balls. Some people might have more, depending on your genetics. And as you age, you start getting some of the aging green balls that also add up to your bucket of risk factors. And also, we know that there's other factors like environmental, sex, so males have a higher risk. There's all these different things, traumatic brain injury, inflammation, all these different things that are also increasing your risk. So they're adding these risk balls, in this bucket. And if you actually fill up the bucket, that's when you're developing the disease. So in most patients with Parkinson's disease, this is what happens. So aging plus your genetic variants, plus the environmental lifestyle things that might happen in your life, make you overflow the bucket, and then you get the disease. Unfortunately, there's nothing we can do with the genetics right now. You're born with those. There's nothing you can do to modify it. So we always recommend to try to avoid some of these environmental factors, and also do things in your life that might help prevent, like exercise, eating healthy, those kind of things that we all know that are healthy ways of living. So if you have a high risk of genetic predisposition, you might want to avoid some of the environmental factors. And then we have the families where, again, there are individuals that have lots of family members affected, or they have early onset Parkinson's, where your genetic factors are very big to start with. So that means that you don't need many other factors, either aging or environmental, to really overflow that bucket. So that means that if you have another family member that is affected, your risk is already really high, and you don't really need environmental or even get too old. That's why people get it really early on in the disease, because that is plenty to already overflow the bucket and get you to develop disease. Hopefully that explains a little bit about how there's two different ways where you can get Parkinson's disease, but they all involve not only genetics, but also aging, which is very important, and some of these environmental factors that are things that we can actually modify. The other things we cannot. Unfortunately, we cannot stop aging either. So, okay. So why is it important to investigate the genetics of Parkinson's disease? It's very important, I think, in my mind, to identify who is at risk for Parkinson's disease, because perhaps we can, again, tell them to avoid some of the environmental factors, or if we can find protective treatments, then these individuals could take those treatments and maybe never develop the disease, and maybe they'll die from something else, but they will never get Parkinson's disease. It can also give us an idea of what your Parkinson's might look like. Here, we probably have a few patients with Parkinson's. I bet you if they talk to each other, they start differently, they're progressing differently. Each individual is really its own Parkinson's disease. And I think genetics can really help us understand what is your Parkinson's disease is going to look like. Are you going to get cognitive impairment? Are the drugs going to work well in you or no? So I think genetic testing can help with that. And also, one of the things that we're trying to figure out is to do something that they do in other diseases like cancer, for example, where they use genetic information to determine what is the best therapy that you should be taking. And I think, our research is trying to determine if we can actually use this information to identify the best treatment, personalized treatment for each individual. And this is something this is how we usually operate right now. So every patient that is diagnosed with Parkinson's disease, it receives a diagnosis, and then we started treating them with usually the same thing at the beginning, and then we see how they respond, and then we titrate the doses and all that stuff. What we're hoping is that with genetics, we can actually identify the different subgroups or subtypes of Parkinson's disease, and then already know through our research to be able to know which is the drug that might be more efficient for that particular patient based on their own genetics. So this is what we call precision medicine or personalized medicine, which again, it seems something of the future, but it's happening in other diseases. And there's no reason why we couldn't have it in Parkinson's disease. There's many ways to participate in research. It's very important to do this. PD Generation is a Parkinson's Foundation initiative where they're doing this in the world, in the U.S. and in some countries outside of the U.S. And you can do this from the comfort of your house. You don't have to go anywhere. And they'll send you a saliva kit, and then you respond some questionnaires, and then you can get genetic testing done. And then you can also get genetic counseling done, which is what Tyler is going to tell you about, and get that data back and use that data for your, to empower you to know more about your type of Parkinson's disease. In this, they look at 7 most common genes. I told you there's many more than 7, right? So just because you're negative doesn't mean that you don't have a genetic form, but it means that you don't have one of the common ones, which are these 7 that I put in here. And you can see here that they've already done this in 7,500 individuals with Parkinson's disease across the United States, and 14% of them had a genetic form of Parkinson's disease. This is also very important because there's ongoing clinical trials for at least 2 of these 7 genes. That means that people that have a variant in one of these genes can participate in these clinical trials that are targeting to stop the disease. It's not targeting the treatment of the disease, but or the symptoms of the disease, but it's trying to stop the disease biologically. So anyways, I really encourage people to participate. If you want more information, we have a table right by the elevators. You can come and ask more questions, and I can give you more information about this. So I'll let Tyler tell you about genetic counseling.
Hi everybody, my name is Tyler Tribble. I'm a certified genetic counselor at the Cleveland Clinic. I see both patients on the clinical side with all sorts of neurological conditions, and then I work with Dr. Mata in the PD generation study for patients with Parkinson's disease. So I'm going to talk a little bit about what exactly genetic counseling is and how it relates to Parkinson's and this study. So what is genetic counseling? Nobody knows what my profession is. That's pretty normal. So genetic counseling is defined as a way for people to learn about and deal with the effects of genetics on their health and their family's health. I have this quote from James Watson, who's one of the scientists who's credited with the discovery of the shape of DNA, who says, "We used to think that our fate is in the stars. Now we know our fate is in our genes." Genetic counselors are healthcare professionals who have advanced training in both medical genetics and counseling. We're members of healthcare teams who help and support patients who are considering or referred to genetic testing. The short description of my job is I do genes and feelings. GCs do a lot of things. Most importantly, we help patients understand what genetic risks they're at. We help patients make informed decisions on if genetic testing is right for them, what those testing options look like, which option is best for each patient. It's different for every person. We explain genetic test results in detail. If you were to look at one of those reports, you wouldn't know where to look because they're not pretty easy to read. So we help go over those with you and explain the importance of all of those things. And lastly, we connect patients to resources and support groups and even other patients with the same genetic conditions to help build support and give you as much information as you can as you move forward. There's a lot of different types of genetic counseling specialties, which I have here. If you're a patient or a family member of someone with Parkinson's, you would likely see a genetic counselor who specializes in either neurology, like myself, or depending on where you seek care, you may see a general genetic counselor within like a general genetics clinic. During the PD generation study, here at the Cleveland Clinic, we have it set up to where patients receive genetic counseling after their test results come in. So this is kind of what a genetic counseling session would look like. This is before you have received your results. You would meet with a genetic counselor like me or a physician. We would start with an introduction. What are we going to discuss today? What can you expect out of our chat? Do you still want to receive these results before I give them to you? It's totally up to you, and you're at any point able to say, no, actually, I've changed my mind. I'm not ready yet. We would go over those results, whether or not they were positive for a genetic cause of Parkinson's or negative. And then we would talk about what those results mean for you. Specifically, are there any changes to your medical management that need to be made? Are you eligible or able to participate in any of those clinical trials that Dr. Mata mentioned? We would talk a little bit about PD and genetics, kind of like Dr. Mata just did, breaking down, if your results are negative, what are the residual risks for one of those smaller familial variants, all of those things. And we would also talk a little bit about your family history. So I would take something that we call a pedigree, which is just a drawn out version of what your family looks like. We would talk about if your results are either positive or negative, what are the risks to your children or your children's children for developing Parkinson's disease. If your results are positive, can your children be tested? Can we arrange for that testing? Can your children come and see me? And we'll go through all of those things. And lastly, we'll do a quick summary We'll answer any questions that you guys have, review and summarize those key points, and we provide you with some support information. One of those things that we often provide is what we call a family sharing letter. A lot of patients don't know how to share these results with their family, especially if they're positive, to tell an individual's family members that they are also at risk for a genetic cause of Parkinson's, and so we go over how to do that together. This is just a quick picture of what a pedigree or family history looks like. So in your session, a genetic counselor or a physician would ask questions about how many children do you have? Does your mom have any health issues? Does your mom have siblings? And kind of get the overall picture of your family. When going over your results, we would talk about both results and the implications that they have for you now, as well as those implications for the future. So results as they impact you now include the risk of Parkinson's affecting a family member, identifying or ruling out specific causes of Parkinson's in yourself, as well as discussing eligibility for clinical trials or any drugs that may be available. Future implications include going over possible symptoms. Like Dr. Mata mentioned, some genetic forms of Parkinson's will cause different symptoms than others. And so we'll go over that if that's the case as well. Do we have any idea of what the progression of this genetic cause of Parkinson's looks like? What information do I have to share with you? And lastly, we talk about help to develop of preventative measures for those at risk. While we do not have anything to prevent Parkinson's from developing in an individual, like an adult who is current, we do have things to help future generations. So if you've heard of IVF, we have the ability to do IVF with pre-implantation genetic testing, which is a fancy way of saying we only insert embryos that do not have the genetic condition. So maybe if your children or grandchildren are trying to get pregnant, they would be eligible for those things, and we would go over those in detail. During the family history discussion, we would emphasize that it's normal to have mixed feelings about your genetic test results. A lot of times it's a silver lining. It's normal to feel either happy or disappointed that you didn't find a genetic cause or that you did find a genetic cause. Everybody's a little bit different, and so we would spend some time talking about your specific feelings. We would also go through different ways that people may choose to share those results with their family members. There's a couple of different ways, and it's dependent on each person's family structure and the relationships that they have. And of course, we help facilitate those discussions in any way that we can. The summary that we would go over in genetic counseling is just that Parkinson's and the genetics of it is kind of complex. Review those risks of specific family members, answer questions, and again, provide those resources. To prepare for a genetic counseling visit, and this counts for both if you're doing the PD generation study or if you're seeing somebody in a clinical medical genetics clinic for your history of Parkinson's, you're more than welcome to invite family members if you would like. It's very helpful to review your family history information with any family that you have prior to coming to your appointment to aid in that family history taking. And lastly, make sure you write down any questions that you have, because during the appointment, we're going over a lot of information and it's so easy to lose those questions. And so we want to make sure we address any questions that you have. And of course, you're always welcome to contact us after the appointment in case a question comes up later. That's it. Thank you guys so much.
All right, so that's it on the genetics. Dr. Mata and both Tyler are willing to answer any questions if you'd like to come up and talk to them, but they also have a table out in the exhibit hall as well. So they'll be around for the rest of the time. Okay, all right. And but other than that, now again is another, we're slightly done early, which is very impressive. There will be exercise again right next door. And then just as there has been this whole time, food, exhibitors, and there will be talks again in another 40 minutes. So enjoy.